Oh, my name's Fred Springborn. I'm with MSU Extension, and I'm here in the field today with Dr. Martin Chilvers, a plant pathologist with Michigan State University. So, Dr. Chilvers, we're seeing a lot of white mold this year. Can you tell us about what this disease is?
Sure, Fred. So white mold, it's a fungal disease, and it overwinters in the soil as sclerotia. And those sclerotia germinate in the spring during flowering, typically, and they produce mushrooms, and those mushrooms release spores that infect the flowers and cause disease.
Okay, and this disease infects the stems and causes general plant decline, right?
Right, it infects through the flowers, and then it infects through those flower petals and causes disease on the stems, and it causes plant death, essentially.
Okay. So we're seeing a lot of white mold this year in 2014. What are some of the factors that have really caused the severity of this disease this year?
Right. So because the white mold fungus, produces spores that land on those flower petals, it really requires cool, moist conditions for that to happen.
Yeah.
And this July, during flowering, it was very cool and wet. And so these conditions that we had really led to a lot of white mold this particular season.
Okay, great. So, Dr. Chilvers, we've kind of talked a bit about white mold and some of the factors causing it to be on such an increase this year. What are some of the management factors growers should be considering about when they're thinking about managing white mold?
Right. So for management of white mold, there's several things we want to be thinking about. Trying to select varieties with good partial resistance. There's no variety with complete resistance, but varieties do differ in their susceptibility. We want to then be thinking about different cultural practices. Narrow rows, heavy planting populations tend to favour disease. Yeah. So if we can go to wider rows and slightly lower planting populations, that can help reduce disease. And then one of the other things we can do is use a foliar fungicide.
Okay.
And it's really important if we're going to use that foliar fungicide to target flowering. Try and get that fungicide product on to protect those flowers from infection.
Because the flowers, that's the first point of infection, right?
Absolutely. Yeah, the spores that are produced from that mushroom are not capable of infecting directly through the stem. They need to colonize through those flower petals.
Okay, so it's really important to protect those flowers. So when we're applying a fungicide, we need to get not just on the top of the canopy, right? Right,
that's right. I mean, the product's not, if you put it onto just the top of the canopy, you're not going to get protection of those flowers. So we want to look at things such as the correct nozzle type and correct gallons per acre to really make sure we get good coverage, and then actual use of the equipment too, making sure we're getting penetration as best as possible to cover those flowers.
So high pressure, lots of gallons,
fine droplets.
Fine droplets. Get that fungicide down to where those flowers are to protect those flowers. Long term, is there anything we ought to be doing as far as crop rotation, anything of that nature?
Sure, that's a good question. So we really want to be thinking about keeping a record of where we're seeing problems, because it might be 2, 3, 4 years before we're back into rotation with a susceptible crop. In terms of the rotation, we can use a grass crop or a grass species such as corn or wheat or some other small grains, which are non-hosts. And our hosts for white mold, typically in this area include soybean, dry bean, and potato. So if we can move away from that and go to some sort of grass.
Okay. So lengthening out of the rotation, and it sounds like with the wide host range of this thing, maybe weed control might be important too.
Yeah, absolutely. If you can control your weeds in the corn or the wheat, that's very important to help
All right.
reduce disease.
Well, great. Well, thanks for the tour today, Dr. Chilvers, and we'll be back in just a few minutes with the results from this plot.
Okay. Thank you, Fred.
Thank you.